Welcome to Psych Health and Safety in Canada. I am your host, Marianne Baton, and today I'm really pleased to introduce you to Blaine Donais, who is the president and founder of the Workplace Fairness Institute. And we have so much that we can talk about around that. But I'll start, Blaine, besides welcoming you, to ask how you first learned about psychological health and safety.
Well, thank you. First of all, thank you, Marianne, for inviting me to this. I always like speaking about these issues with kindred spirits. Who I know there's a group of us who are so passionate about this work that it's a pleasure to be doing this with you. My involvement in psychological health and safety actually goes way back to my teenage years and experiencing what my mother went through as a cook in a hospital, and how the employer wanted to cut back on food costs and so on, and we're telling the cooks that you can only have so many ingredients and so on and so forth, and of course this is a small town Saskatchewan. My mother knows every last patient in the hospital, and probably knows their kids and everything else, and her colleagues refused to do that, and they cooked proper meals and so on, and they were punished for it. And and it had a pretty serious impact. It had an impact on her and her colleagues, and this underlined to me that there is a lot of damage that can be done in the workplace to the psychological health of people. My career choices really reflected that, the passion for that study, starting with going to law school, and then choosing to be a labor lawyer, working for a union, whose specialty, was very much representing people who were, victims of psychological health challenges, psychological damage in the workplace, and then sort of moving from there into an understanding about the actual impact of some of these litigation processes and the impact of those processes on psychological health, investigation, grievances, courts, so on. And so very, very early on, in the late 90s, by the time the late 90s came around, I was already becoming well in tune to alternative approaches to dealing with issues in the workplace, and approaches that now would be defined as trauma-informed approaches to managing issues, but at the time were referred to somewhat, I think erroneously, as alternative dispute resolution. From there, I founded the Workplace Fairness Institute in 2005. And it was founded on the proposition that that every workplace participant deserved equity of concern and respect, and that this could be achieved. This could be achieved through proper evaluation of structure and leadership and so on in the workplace. And interestingly enough, while all of this was going on, another important figure in the psychological health and safety world was working in parallel with me. We didn't know each other. We had never met, but was working in parallel with me while I was coming up with what I called, fairness standard, fairness evaluation. This other person was talking about psychological health and safety. And that, of course, is Dr. Martin Shane, who's the, I guess considered to be sort of the father of the national standard on psychological health and safety. And so he did his work, I did my work. The standard came out in 2013. I knew that it had come out and had some very, very limited involvement in it, but I still hadn't met Martin. And then about 2 years later, Martin approached me and said, look, I'm not all that happy with the way the standard is being rolled out, that it's too complicated, that assessment and implementation for psychological health and safety is very, is very complicated and is discouraging a lot of employers from embarking on this journey. So he said to me, could you please come up with something simpler? And so I worked partly with him and, partly with some of my other colleagues to provide sort of kind of simpler versions of these tools so that in practice, so that workplaces could, feel confident that they could get through this process and get somewhere. And the theory that we worked on was the enemy of better is perfect. So the adoption of the standard, the implementation of the standard was something reaching toward perfection, and that's great. That's fantastic. And for some very well-resourced employers, it's also doable. But for many others, it was just it was a bar that was too high to aspire to. So we came up with just very simple evaluative tools that even the people sitting around at the board of directors table could just get their heads wrapped around these 13 psychosocial risk factors and just think about, well, how are these things affecting us? What measures do we have in place to protect people from psychological harm related to these things? And that has had some success. I've done a lot of work with federal government and federal government agencies in doing these sorts of versions, what we call workplace health assessments, and so yeah. So I mean, it's to me, it is the national standard on psychological health and safety is one of the most profound statements about psychological health and safety that has come up in the world, and it has seen huge impact in terms of its influence on the laws of our country, including the laws in Ontario with Bill 132, and how investigations are supposed to take place, the laws in Alberta with Bill 30 that has basically said in their occupational health and safety legislation, employers have a duty to protect workers from psychological harm. Now, this is a positive duty, which can be, litigated if an employer fails in that duty. And then Bill C-65 in the federal jurisdiction that has gone even further, way further than that, requiring employers and their applicable partner, being the occupational health and safety committees, to prevent harassment and violence in the workplace, to protect people who are kind of in the processes involved in that, and to support them as well. And these three pillars are designed to, in a way, operationalize the notion that a lot of what goes on in Canadian workplaces runs the risk of psychological harm. Dr. Shane coined the phrase, I think, very, very well when he called it the careful workplace. How we must be careful in the way that we, in what we do. And when he's saying careful, he sort of means that in two ways. One way is be prudent and thoughtful, but the other way is to actually care about what's going on, right? So yeah, so that's how I got involved in it, and and have ended up working. A large part of my practice is devoted to, and a large part of the Workplace Fairness Institute's work is devoted to work related to psychological health and safety.
That's great. Thank you very much for all of that. I actually say sometimes, Blaine, that we can start psych health and safety by asking how this, whatever policy, process, procedure, interaction, meeting, event is going to impact psych health and safety. So even like you say, it's different stages, right? But there's no reason any employer can't start. It's just a matter of the amount of time and effort they're willing to put in, but even that question would start them. But tell me a little bit more about the tool that you created, and you said you sit around a boardroom and you think about it. How does it actually work?
Yeah, well, it's based on the simple notion that that while psychological health and safety is very complicated, there are some very simple things that can be done right now to improve the protection of psychological health and safety in literally every workplace. And not only that, but virtually everyone has the wherewithal to come up with an idea that can improve psychological health and safety. So the standard is built around what's called 13 psychosocial risk factors, and some of these risk factors are very interesting because they touch upon areas that in the past have been left completely to employer discretion to manage.
Management rights.
Yes, exactly. Management rights. So, employer discretion without any review or second thought. Now, that in a unionized workplace, that's always been, that proposition has been limited somewhat. But what the standard is saying is virtually everything you do as the employer has the potential to cause psychological health and safety or psychological harm. There's a potential to do that. And when you look at the kinds of risk factors that we're talking about, these are things that never, 20 years ago, would never have been imagined to be something that should be the subject of evaluation or review or second thought. You look at some of these things, like the obvious ones, civility and respect. Okay, well, we knew that was coming. We knew that was going to be a part of psychological health and safety. But what about involvement and influence? So involvement and influence is one of the 13 psychosocial risk factors. And which means that the lack of involvement, the lack of influence in the workplace is a source of psychological harm. So thinking that through in terms of this, the traditional operationalization of management rights, every worker, to protect that worker's psychological health, you need to involve that worker in what is going on in the workplace and meaningful decisions in the workplace, and that worker must have influence in what's going on. Like this is a fundamental change to the notions of power in traditional hierarchical workplaces. So it's, another way to put it is that it's revolutionary.
And yet the involvement and influence, the way that it's explained, is in how you do your work. Well, if I just say, do your work, don't ask any questions, don't have any input, even places that have a lot of standard operating procedures that they're highly regulated can still have some interaction with their employees about innovation or about doing it in a more effective way that works for them. But you call it a psychosocial risk factor, but I see all the factors as potentially protective or potentially a risk. That the more that, say, workload management, right now we're just up to our ears, there's nothing we can do. Well, that's the reality. But what could we do as a protective factor to balance that out? Maybe we give you more balance in your life by giving you more flexibility so that you've got the energy to do it. Or maybe we give you more involvement and influence so that you're more committed to whatever this workload is. So that I think there's lots of opportunity here. So in your tool, do you have them just sit and talk about each of the factors and what they could do?
Yeah, we take each psychosocial risk factor and we say to them, we ask them, how is this risk factor being protected? How is this risk being protected in the workplace? And they have to think about that. How is, good organizational culture being enhanced, being supported, being protected? How is that happening? Then we ask them to evaluate it on a scale of 1 to 10. How well is it working? 1 being pretty bad, terrible, and 10 being, perfect. And it doesn't matter how they evaluate it. The fact is they're thinking about it now. They're not just, they're thinking about the 3 main elements of systems analysis and design, which is identification, evaluation, and amendment. And so the third thing is we say, come up with one thing that you think will improve this rating. Tell us why you think it'll do that, and tell us how much you think it will improve the rating. So, you have these people sit around the table, they write stuff down, they talk about it. You might actually assign, there's 13 of them, right? So there's quite a bit there. So you might assign 1 or 2 to each person. They talk about it and they, talk about it around the table. And at the end of an hour or 2, they actually have a plan. They've got a plan of, maybe 13 to 26 things that they can do to improve psychological health and safety in their workplace. And so, it's, as they're doing that, something else is happening. We're meeting one of the central or one of the psychosocial risk factors, which is engagement. We're engaging these people in the process of thinking about psychological health and safety. We're empowering them with involvement and influence to start, making making proposals for how to change. And that's something that you can do at the board table. You can do it in a survey process for all the staff. You could do it as in any sort of iteration you want it, right?
Yeah. So just that's the thing is, somebody said to me once, well, I think we've eliminated all the excuses about why we don't address psychological health and safety. Can't be money. We've got resources. Can't be expertise. It's out there. It's available to you. Can't be, we don't have the time or resources. There's so many ways that they can do it. But something you said, Blaine, about dipping into what was traditionally protected as management rights is revolutionary. And the piece that I've always felt most did that was 4.4.1, which is that, and I'm paraphrasing this, but that if you are a leader, that you ought to be competent to lead in a way that's psychologically safe. And to me, that's like, oh my goodness, like that's interesting, because before you're a leader, you have the power, you have the authority, and that's it. But now we're saying you actually need to do no harm.
Yes, and even in my view, the process of doing no harm with psychological competencies, the process of doing no harm requires you to do a lot of good, because how do you ensure that you are doing no harm? As a leader, you're doing it by promoting involvement and influence. You're doing it by promoting engagement. You're doing it by promoting work-life balance, workload management, all of these things. And yeah, I agree with you. One of the most revolutionary things about the standard is it's actually stepping right into the job documents of people and listing a whole bunch of competencies they must have to be good leaders, which is radical, right?
Yeah, that the job description itself needs to say what's required. And I always use the example that librarians are trained to manage books, and yet they can have somebody come in off the street that is impaired or angry or aggressive, and often they're not given the proper training to deal with situations like that. And I think that the evolution is going to be that it's not enough to train people to do their work. We also have to have what Francois Mathieu calls our psychological PPE, our psychological protection, that to be able to deal with whatever our work offers us. Now, there's some things that are completely random and not foreseen. And, that's what it is. But so many jobs, we know that they could end up having to deal with this. And even if we say, you might have to deal with an angry customer, that's not enough. And what do you do? And who's there to support you? And how might you feel? And how might you recognize whether this was really a traumatic incident for you and that you need to get more help? What are your thoughts? What are your feelings? So I think that's going to be a bit of an evolution for us going forward, thinking about that.
Well, it's interesting, the connection between the national standard and Bill C-65, which has been very directly made. And in Bill C, because what Bill C-65 does is essentially, is dealing with extreme forms of psychological injury, harassment, and violence. But what it's saying is that there are all these environmental factors that contribute to harassment and violence in the workplace. And what are those environmental factors? You'll see, for example, Crown Indigenous Affairs and Northern Affairs Canada, in their policy, they state specifically, as it relates to the quote unquote risk factors for violence and harassment, that the foundation for this is the national standard on psychological health and safety. So they see workload management as a potential risk factor for harassment and maybe violence. The lack of engagement, psychological protection, so on. So it's, so the world of work is quite rightly converging on these things, right?
Mm-hmm. I wonder if you can talk, you did allude to it already, about sort of the evolution of conflict resolution and how it's changed over the years. You said from one type to another, but what do you recommend as the most effective approach to conflict resolution today?
Well, this is something that has been, I would say, my main area of study is the study of conflict, and let me say that when I first began the journey in this regard, it was called alternative dispute resolution. So, alternative to what? Alternative to litigation. Was used to be the most prominent thing. And so when they talked about, and by the way, they would name grievance arbitration as alternative dispute resolution. One of the original ADRs was the Labor Relations Acts that took resolution of disputes in the workplace out of the courts and into this arbitration function. So, alternative dispute resolution. So there are two main evolutions that have happened with the thinking since we started using the phrase alternative dispute resolution. The first one has to do with disputes, and I'm now talking about the workplace specifically here. Disputes. So what are disputes? Abel, Felstiner, and Surratt would say the following about disputes. In order for there to be a dispute, there has to be a conflict. And this is how it works. In order for a conflict to arise, there has to be four things that happen. First of all, there has to be a perceived injurious event. Then there has to be naming of that event, claiming, and blaming. So looking at this from a workplace perspective and psychological health and safety, one of the biggest problems with this, and by the way, it doesn't become a dispute until there's a forum in which to play that conflict out. And so just thinking about this, you have a worker in a workplace who has a problem, highly hierarchical workplace, extreme power relationships. For this to become a dispute, even before it can be resolved, for it to even become a dispute, there has to be a perceived injurious event, there has to be naming, blaming, and claiming. In a psychologically unsafe workplace, there will never be claiming, right? Because of fear of reprisal. And so this whole concept of dispute in the workplace setting had to be seriously renovate it. So we don't call it dispute anymore. We call it conflict. And the vast majority of conflict that happens in the workplace setting, even today, even after the Psychological Health and Safety Standard, even after Bill C-65 and so on and so forth, is one-party manifest conflict. It is conflict where there has been a perceived injurious event against me. I have named it. I have blamed someone else, but I have not claimed. I haven't claimed because I fear the implications of doing that. I fear what that will do to my career. I fear, reprisals. I fear all kinds of things. It may not be active reprisals, but I fear not being treated as a team player anymore. We're banging into the Psychological Health and Safety Standard here. And so if we were going to have a system that is going to grapple with that problem, you would have to have a system that is focused primarily on prevention to make sure, because here's the deal. We also know that it's actually possible to eliminate the opportunity for the conflict to arise in the first place. And how do we do that, right? Partly how we do that relates to how a perceived injurious event happens. And one of the ways that a perceived injurious event happens is that something happens to you, you blame someone else, and you make negative attributions toward them. This is attribution theory. You make negative attributions toward them, and then the next time something comes up, your hardwiring takes you directly to the negative attribution. This is that selfish person who never cleans up the kitchen sink, whatever it is, right? And so that's a cause of even more perceived injurious events, and these proliferate and they escalate. Reuben Pruitt and Kim in the book Social Conflict talk about this, about how conflict transforms and all the ugly ways that it transforms, and from few to many, from small to large, from specific to general, all this stuff. And so, as I said before, the first big change in this whole thinking was to redefine how we looked at conflict, not as something that only exists when there's a forum for it to be resolved in. That would be a dispute. But something that exists in the absence of any opportunity to resolve it, because that's what causes the most psychological harm. This comes back directly to the foundational theory of the national standard, which is high demand, low control environments. In high demand, low control environments, that this is what causes the most psychological harm. And so the second big change in our thinking has to do with the word resolution. So in this case, a perceived injurious event that's named and blamed is going to cause psychological harm and yet never be resolved. And back to the proposition that you can actually reduce the incidence of perceived injurious events, we've changed the term to management. So we no longer talk about alternative dispute resolution. We talk about conflict management. Conflict management with a heavy emphasis on proactive prevention, evaluation, having tools in place, having structures, procedures in place, making the right choices with regard to resource management, who you hire, what you hire for, what their competencies are, and how you take care of people. Because that point, and which I could sum all that up by calling it fairness. The relationship between fairness and conflict management is crystal clear. And that is that if you do not feel treated fairly, the number of perceived injurious events are going to proliferate, right? Because you're making negative attributions toward an organization and the people in the organization who you feel are treating you unfairly. And that will be a cause of extreme psychological harm. And so, this has evolved. Our thinking on this has evolved quite dramatically, and it's actually one of the reasons why Dr. Shane approached us in the first place to talk about, well, can't we make this simpler somehow, right? Because what he was saying is, look, you and I are saying exactly the same thing. We're just using different terms. I'm using psychological safety and health, and you're using fairness. But we're talking about exactly the same problem, right?
Yeah, how people feel, how safe they feel in the workplace. So it's very much connected. Blaine, can you tell us a bit about what the Fairness Institute is and what it does?
Yeah, okay. So as I said before, the Workplace Fairness Institute started in 2005. And it partly started on the basis of a book that I wrote called Workplaces That Work. And it was focused on this proposition about fairness and the relationship between fairness and conflict management, and I didn't call it this at the time, but psychological health and safety. And the what we had done was studied like 200 workplaces across Canada. We developed an evaluative tool that would be used to evaluate workplace culture, sources of conflict, and identify the conflict management system or systems that are in place. We developed an evaluative tool for that, and then sort of amendment procedures. And so a large part of the work that we were originally doing was built around that. And from there, we went to one of the more kind of restorative pieces, which we call workplace restoration. And we developed a whole sort of paradigm for workplace restoration, which embraces the standard and especially embraces involvement and influence and engagement as key parts of workplace restoration. And when we talk about workplace restoration, we're talking about dealing with trauma in the workplace, essentially. And in many cases, it's complex trauma. So it's, not necessarily a shooting in the workplace, but this day after day, repetition of unfairness and, and whatever else that's going on. And so we developed a process and have, performed dozens and dozens of workplace restorations across the country. We've got an office in Toronto and one in Calgary, and many practitioners who sort of work on a contract basis across the country, doing the work using the models that we've developed on that. And then more recently, we got into the world of violence and harassment risk assessment for the purpose of supporting federally regulated workplaces with Bill C-65. And here we work with extensively with Health Canada to develop a tool that could be used to analyze the risks of violence and harassment in these workplaces, and and come up with a process for data building and results. And so that's been a very big emerging part of the practice that we've had. And then there's a few other things, workplace investigations, and a lot of training, and sort of engagement processes, union management, relationship building type things. So yeah, and just recently we've actually gone through a name change to Workplace Fairness International. I won't bore you with all the details there, but part of the reason for that is that we have found an appetite across the world for some of the stuff that we're doing, and so we're sort of exploring that and working on it.
That's great. Can you tell us a little bit more about both the violence risk assessment and the process that you use in the workplaces around the restoration?
Okay, so first of all, with violence and harassment risk assessments, these are creatures of Bill C-65. So Bill C-65 requires the employer and the applicable partner to, number one, identify risk factors for violence and harassment in the workplace, and number two, evaluate those risk factors. And then number three, of course, develop additional protection and prevention measures to make sure that those risks are reduced. And so what we did was we developed a tool that could embrace any risk factor that was developed by any federal government department or agency or federally regulated employer, where essentially they articulate the risk factors, and sometimes we work with them on that, to help with best practices and that sort of thing. And then we take it through this kind of rigorous approach of understanding the data, applying the data, and coming up with results. And so one of the big things that the employer has to do is to identify the protection and prevention measures that are in place. So that's a pretty laborious process. As you know, there's like, so for example, with one of the clients that we're dealing with, we identified 45 risk factors. And so, to figure out everything that's going on in the workplace that is designed to reduce the risks related to each one of those risk factors is a colossal task. But that's, so what we do is we identify the risk factors, identify the present protection and prevention measures. We look at data, and sometimes we have to generate data. We often have to generate data. So we either use the public sector employee survey, or we develop our own survey related specifically to the risk factors. And we ask people related to each one of these risk factors, what's the likelihood of risk and what's the value of protection prevention measures. We also follow that up usually by interviews and focus groups. And then on the basis of all that, we have a rating scheme that gets us to a number. And the number is the risk rating. And if that risk rating is anything other than low, then we say that Bill C-65 requires the employer and the applicable partner to do something about it. So they now have to introduce additional protection prevention measures. And so that's, that's kind of the process as we take it through.
Are you assessing individuals for risk of violence, or are you just assessing organizational factors?
Organizational factors, yeah. Okay. Yeah, we don't assess individuals, although clear leadership and expectations is one of the risk factors. And so, to a certain extent, and depending on how granular you get, you may be identifying leaders that are problematic. We try to focus more on the broad organizational piece with the violence and harassment risk assessment, partly because Bill C-65 has other things that are there to manage, what happens if let's say there's a leader that's doing something. So Bill C-65 has very much enhanced the investigation and assessment process to deal with that, and made it quite a bit more safe to raise concerns. They don't even call it complaints anymore. They call it notices of occurrence. And anybody can file a notice of occurrence. You don't have to be a victim. And this is very important because one of the central ways that they are finding to manage violence and harassment in the workplace is to empower the bystander, right? So let the bystander have a way of reporting this in a way that's safe for them.
Yes, because the target may not feel safe to do it. And if the people around have the courage, have the insight, can make a big difference.
Yes.
And Blaine, with the restorative justice type approach, I remember reading about how in the hands of somebody who isn't skilled, it could and has actually led to more trauma. Yes. Can you speak to why the process that you're using doesn't do that?
Well, it's partly the process, but it's also the practitioners in the process. So the very first thing that we insist upon for all practitioners is that they are trained in trauma-informed approaches for managing conflict. And this is critical because without exception, every workplace that we go into where we're doing a workplace restoration involves people who have suffered trauma, every last one of them. And so we need to be very careful to ensure that the practitioners who do this work actually really understand what they're doing and understand, the consequences of what they're potentially doing. The second reason why this process, in my view, actually works better than some of the other alternatives that I've seen has to do with the concept of client-centered process design. And so in distinction with another model, which I'll call the group intervention model, what the group intervention model does is that it calls together everyone in the group and has them sort of work together to come up with ideas to make things better. And often the everyone in the group does not include the leaders. And so this is one of the reasons why there's a potential for psychological harm. First of all, because you are you're having the staff put themselves out there. You don't have the leaders involved, so no involvement and influence. And there's a I think a pretty scientifically sound proposition here, and that is that without involvement, there's no responsibility. So here you have a situation where the staff actually don't have any power. You're expecting the staff to come up with all the solutions, and so they come up with these solutions, and then nothing ever comes of it, right? And in the meantime, maybe somebody hears about what something that somebody said in the middle of somewhere, and there's reprisals. And so this further traumatizes people, so what we try to do is recognize that there are power relationships in the workplace, and we want to engage people at all different levels of power relationships. So how we do this, first of all, is we create a team. This is not just the worker. And also I want to mention that the vast majority of situations that require workplace restoration don't necessarily involve toxic individuals within that work group. In fact, in our experience, the significant majority of situations involve toxic leadership. And that's a fact. It's it's at least an observational fact from our point of view. Of course, there can be toxic individuals as staff in the workplace, but often where we get called, there's something that's going on, and so we want to build a team. And we want that team to kind of emulate what a positive, productive workplace looks like. The team will consist of leaders, line management, HR, union leaders, and representatives from the staff that are chosen by the staff. And this team will work with the facilitator to actually organize this restoration, and they will perform a communication function, an advocacy function for the process, and a feedback function. So we get to know very early how this process is working. We get to have tested. In my experience, the union leaders will test the lack of transparency from employer leaders on this, which is a good thing. It helps make the process transparent, and then using a trauma-informed approach, we want to take the assessment phase one step at a time. We want to start on an individual basis with each individual in the workplace. Why? Because if you started as a group exercise, you run the opportunity of re-traumatizing people. So you need to prepare them for this. Ultimately, there will be a group exercise, but they need to be prepared to get there through, first of all, often with individual work, sometimes conflict management coaching. Our practitioners are all trained in conflict management coaching. They're all trained in interpersonal mediation. They're all trained in assessment, health assessment, and trauma-informed approach. They all keenly understand privilege, bias, fragility, all of these things that are required to actually practice in this field now. and 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 then usually we go to interpersonal mediations to try and deal with where there are one-on-one type problems with individuals. Why? Because we want to eliminate that as a distraction when we get to the group process, which is intended to maximize engagement and influence. With larger workplaces, we've also introduced a survey as a beginning piece to that, just because it helps to kind of maximize the number of options that people have to contribute. So the options typically for larger workplaces are survey, interviews, focus groups, and surveys, interviews, and focus groups. And then on the basis of that, we work with the restoration team to write a report that has recommendations. And usually they're recommendations related to the process, like what do we do next, how do we do it, and so on and so forth, right? But there could be recommendations related to structure, and we're going to provide feedback from what we've heard, in a methodical way. And so it's not placing all the responsibility on the shoulders of people who have no power in the workplace to solve all the problems in the workplace. That's how we try to manage this in a much more realistic way.
So Blaine, I don't know if this is an area, but I kind of think it must be for you. But this year I will be hosting roundtables on inclusivity and asking experts to come and think about some research that was done about why psych health and safety is experienced differently by what I call marginalized populations. So whether it's racialized groups to LGBTQ+, or it is people with disabilities, even people with chronic pain, and to think through what we could do differently. I don't think that Canada as a whole is horrible, but I think we definitely can do better. So can you speak to that?
Yeah, well, so first of all, we have recognized that the lack of diversity, inclusion, equity in the workplace is a risk factor for violence and harassment in the workplace. So that's been very, very clearly established. It's now being assessed in many federal government departments and agencies as we speak. It's something that WFI actually had to insist upon for many of the clients, because they didn't quite get, how these things connected. But there is, without question, there is a clear connection, intersectionality, and the experience of privileged populations versus unprivileged populations related to a lot of these issues. And when we put into operation the standard for assessing harassment, the legal standard for assessing harassment, this is where it becomes crystal clear. When, as an investigator, when I have to decide if somebody has been harassed or not, what I have to do is decide whether, on a balance of probabilities, there was a course of vexatious conduct or comment that's known or ought reasonably to be known. Well, from whose perspective ought it reasonably to be known? And so the human rights paradigm for a couple of generations now has made it very clear that it's from the perspective of the victim. So now let's consider the perspective of the victim. As the victim is a woman of color. there's discussion in the workplace about certain cultures and so on and so forth, and this has a huge impact on this person. Well, it doesn't have an impact on anybody else, but it doesn't matter. It's still harassment, right? And it doesn't matter that nobody intended for there to be an impact. And so that's where, like in a more extreme point of view, that's where we need to kind of think about this from a psychological health and safety standard perspective. You know, decisions related to growth and development. For example, what kind of assumptions are being made? And let's say female ghetto jobs within a workplace, right? What kind of assumptions are made about what is growth and development there, as opposed to the scientists, whatever, the old white male scientists at the other end of the office, right?
So maybe some of what we need to do is come up with scenarios and questions related to it, so that good people who are just ignorant to what's happening can have their eyes opened.
Yes. Well, and this is just it, right? Like, I know that the world, that the thinking on this has moved from unconscious bias to implicit bias as a way to describe what is going on there. But essentially, in my view, the vast majority of people who are saying things that are having a negative impact on others don't really appreciate why that's happening, how that's happening, and haven't, partly perhaps because of their privilege, haven't had to experience that themselves, in any meaningful way.
Yeah.
One of my colleagues is a expert in this field, and she might be somebody I could recommend, having a chat with you about. She's a very, very interesting person. Yeah.
That would be great. I'd appreciate that. Blaine, I think we could just go on and on with all these things, because you've so articulately linked psychological health and safety to fairness, and they're just intertwined. They're the same sort of thing. But what I wanted to ask you is, if you were to describe psychological health and safety in the workplace to somebody who has no concept, but you want them to know what it would look like, what it would feel like to be in a psychologically healthy and safe workplace, how would you describe that?
Well, I think I would start with, what do you think it would look like to be in a physically unsafe workplace? What does this workplace look like to you? Live wires in a puddle of water, ladders with one of the legs not standing up right. Maybe the foreman telling somebody to go and go up 30 stories to clean windows without anything on, or walk into an irradiated room without proper protection, so on. I think that people can imagine what that might look like and how they would feel, and and what they would want to do about that. And then on the proposition that psychological safety is exactly the same thing as physical safety, because a psychological harm is actually physical harm. It actually physically harms you. to experience psychological harm. It changes many things about your physiology, your heart rate, your heart condition, your stress levels. I could go on. Hypertension, like in extreme cases, and so on. And so psychological health and safety is physical health and safety. It's just more complex. And it treats this thing that over top of my glasses here as something physical. But there's something physical going on there, and there are things that can happen in terms of communication that will have a negative impact on my physical health because, of course, of my psychological health. And I could go on and on about studies that show the relationship between psychological health and depression and suicide, and higher accident rates and communication, lack of communication, and so on. Like, all of these things are physical consequences of a lack of psychological health and safety. And so while it might sound complicated to protect as it relates to psychological health and safety, it's actually not much more complicated than it is for physical safety. When you think of what has to happen in an office for it to be safe, the electrical has to be safe, the plumbing has to be safe, the floors have to be even and safe, and so on. There can't be, like, I could just go on for a year about all the things that have to be checked with WHMIS. And in large workplaces, safety inspections are taken so seriously. Ontario Power Generation and nuclear stations. I mean, safety inspections are extremely important there, and they're complicated. They require professionals to actually do the safety inspections, and this is taken extremely seriously. That's no less, that's no less complicated or more complicated than psychological health and safety. There are things that we know that contribute to, that are risks for psychological health and safety, and we know there is a growing body of knowledge for how to protect psychological health and safety in the workplace, and how to enhance psychological health, just like there is for enhancing physical health.
If I was looking at a workplace that was doing it well, that was psychologically healthy and safe, what might that look like? How could you tell by looking at a workplace that they are psychologically healthy and safe?
Yeah, so just have a look at the risk factors. So you can see that in a workplace that's typically and this is not an off-on switch. There's a spectrum here, but workplaces that fit higher in the spectrum of psychological health and safety, they have measures in place for psychological support. They have extensive training and expectations for leaders, and their resource management policies have them pick leaders based on competencies that will enhance psychological health and safety. There's extensive training programs and awareness programs related to civility and respect. There are consequences, significant consequences, where there's lack of civility and respect. You can see, I can tell you right off the bat, an organization where there's a lot of involvement and influence is an organization where people are excited all the time. They're excited to be there. They're excited to work. Why? Because they're having an impact. And you can see that, walk into any staff meeting. Are people actually talking to the staff meeting? Or is it just, the manager talking and everybody listening and then, or, playing with their phone or whatever else and then getting the hell out of there? But that's a sign of, that says something about psychological health and safety there. It says something about influence and involvement. And, I could just sort of go through that list. An organization that's really focused on growth and development for their staff is an organization to which people are loyal. They are loyal and responsive. And therefore, if something happens, people are prepared to give each other the benefit of the doubt, and therefore fewer perceived injurious events happen, and therefore less conflict and less psychological harm, right? So they're all interconnected, right? So, I think you could go through the 13 psychosocial risk factors, and if you looked at that and scored an organization on the basis of how much did they respect work-life balance, you would immediately be able to tell how psychologically safe and healthy this workplace is. This is why I think the 13 risk factors are a really good sort of measure of health and safety from a psychological perspective.
That's great, Blaine. Thank you so much for joining me today. You're going to see little clips from this podcast on LinkedIn, on Flourish DX's LinkedIn and my own, but people can find you there too, right?
Yes.
On LinkedIn, and the new Workplace Fairness International.
That's right, Workplace Fairness International. Yes.
That's great. And the entire podcast will be on the psychhealthandsafetycanada.com website. So thanks so much, Blaine, for joining me and for sharing all this with everyone.
Thank you. Yeah, it was a real pleasure.